kidney pain, stones, swelling, or foamy urine? Most kidney problems creep up silently, until they don't. Today I'll show you how stones form, how some can pass safely, how to lower your risk, what actually helps your kidneys and urinary tract, and when to see a doctor fast. This is education, not personal medical advice. 1. What your kidneys do. Your kidneys filter your blood 24/7, balance water and minerals, control blood pressure, activate vitamin D for bones, and remove waste through urine. When they struggle, you may see swelling, fatigue, high BP, or changes in urine. 2. The big kidney problem map. Common issues: chronic kidney disease, often from diabetes and high BP, kidney stones, infections, pyelonephritis, obstruction, and rare genetic conditions. Today we'll go deep on stones and urinary tract care, then touch proven habits that protect kidneys long-term. 3. Kidney stones 101, types and amp, risks, graphics plus real food cutaways. Stones form when urine is too concentrated and certain crystals stick together. Calcium oxalate, most common, risk. With dehydration, high sodium, high oxalate foods, large frequent portions of spinach, nuts, beets, very high vitamin C, low dietary calcium, and gut issues that raise oxalate absorption. Uric acid, acidic urine, high purine diet, organ meats, large red meat portions, obesity/diabetes, gout. Struvite, from certain urinary infections, usually needs procedures. Cystine, rare genetic cause, needs very high hydration and specialist care. Key risk factors: low fluids, lots of salt, high animal protein, sugary drinks, frequent UTIs, family history. 4. How to pass a stone safely, doctor-guided plan. Many stones less than or equal to 5 to 6 mm can pass on their own with the right plan. But pain can be severe, and complications happen. Work with a clinician. Core steps, show checklist. 1. Hydration, small, steady sips aiming for clear to pale yellow urine. 2. Pain control, doctor-guided, NSAIDs often used for renal colic, but not if you have kidney disease, ulcers, blood thinners, or pregnancy, especially third trimester. Acetaminophen is safer for many, but still follow medical advice. 3. Alpha blocker, physician prescribed, for example, tamsulosin, may help relax the ureter to pass certain stones. Side effects: dizziness, low BP, not typically used in pregnancy. 4. Strain your urine to catch the stone for lab analysis, this guides prevention. 5. Imaging, US/CT, if pain persists, fever, or stone likely and GT, 6 mm. Go now if, red icons, fever/chills, 1 kidney or kidney transplant, unstoppable vomiting, severe constant pain, no urine output, or pregnancy with significant pain. 5. Keep kidneys clean, myth bust plus what actually works: no tea or detox drink scrubs your kidneys. Your kidneys are the cleaners. Support them with habits that reduce crystal and toxin load. Fluids, target /2 to 2.5 liters of urine/day, often 2.5 to 3 liters fluids, unless your doctor limits fluids. Salt, less salt equals less urinary calcium, avoid heavily processed foods. Balanced calcium, don't avoid calcium, get normal dietary calcium with meals to bind oxalate in the gut. Protein, favor moderate portions, too much animal protein acidifies urine and raises stone risk. Weight, BP, sugar control, protects kidneys broadly. Avoid megadoses of vitamin C and D unless prescribed. 6. Stone type prevention, quick menu cards: calcium oxalate, normal calcium intake at meals, dairy or fortified alternatives. Reduce high oxalate foods in large frequent portions: spinach, almonds, beets, rhubarb. Citrate helps: lemons/limes, real juice in water, add urinary citrate that discourages crystals. Consider potassium citrate, doctor prescribed, if urine citrate is low. Uric acid. Alkalinize urine, raise pH, with potassium citrate or sometimes sodium bicarbonate, only under medical guidance. Lower purine load, smaller portions of red meat/organ meats, cut sugary drinks. Allopurinol may be prescribed if uric acid is high. Struvite treat the infection and often remove stones. Prevention equals infection control, doctor directed. cysteine very high hydration, often and GT, 3 liters/day, low sodium, specialized meds, for example, teobrinin, from a specialist. 7. Urinary tract care and AMP, UTI prevention to clean the urinary tract, think flow and barriers. Hydrate steadily, don't hold urine long. Urinate after sex, gentle front to back hygiene. For recurrent UTIs, discuss with a clinician, D-manners, prevention aid for some, not a cure for active infection. Cranberry L may reduce some UTIs but can raise urinary oxalate and may interact with warfarin, stone formers, and those on blood thinners should be cautious. Topical vaginal estrogen, post-menopause, can reduce recurrent UTIs, prescription only. Active infection needs antibiotics chosen by a clinician, untreated UTIs can damage kidneys. 8. Medicines and AMP, natural products, what they're for. And GT, always clinician guided. I'm listing common tools, not telling you to self-start. Potassium citrate, raises urinary citrate/pH, useful for calcium oxalate and uric acid stone prevention. Warning emoji, avoid/use extreme caution with kidney failure, high potassium, ACE inhibitors/ARBS/potassium sparing diuretics, not for self-start in pregnancy. Tamsulosin, alpha blocker, may help pass certain ureteral stones. Warning emoji, dizziness/low BP, limited data in pregnancy, generally avoid unless specialist directs. NSAIDs, for example, ibuprofen/naproxen, for renal colic pain. Warning emoji, avoid with CKD, ulcers, blood thinners, avoid in third trimester, use only short course if your clinician okays it. Acetaminophen, paracetamol, pain/fever option with kidney safer profile when used correctly. Warning emoji, respect total daily dose, liver disease caution. Allopurinol, lowers uric acid for uric acid stones/gout. Warning emoji, possible serious rash/allergy, not for pregnancy unless specialist decides. Thiazide diuretics, reduce urinary calcium for recurrent calcium stones. Warning emoji, electrolyte imbalance risk, sulfonamide allergy caution, pregnancy, specialist decision. Antibiotics, for proven UTIs/struvite stones, culture guided. Warning emoji, choices differ in pregnancy, nitrofurantoin/fosfomycin often used but require clinician judgment. Natural supports, adjuncts, not cures, water, king. Citrus, lemon lime, for citrate. Water-rich foods, watermelon, cucumber. Moderation with parsley/celery teas, mild diuretics. Warning emoji, avoid in pregnancy and if you have plant allergies. Ginger can soothe nausea, check interactions. I don't recommend unproven stone-dissolving herb mixes or harsh kidney flushes, they can harm. 9. Pregnancy and AMP, allergies, dedicated segment. Pregnancy, most stones are managed conservatively, hydration, rest, acetaminophen for pain, ultrasound for imaging. Avoid NSAIDs in third trimester, most herbal diuretics, and self-starting alpha blockers or alkaline ices. Antibiotics, clinician chooses pregnancy-safe or options. Any fever, severe pain, vomiting, or inability to pass urine, urgent cars. Allergies. Tell your clinician if you have sulfur allergy, thiazides are sulfonamide derived, penicillin allergy, affects antibiotic choices, or prior allopurinol rash, don't retry. Herbal product allergies are common, test cautiously or skip. 10. Red flag symptoms, big icons, fever/chills plus back or side pain, severe constant pain with vomiting/dehydration, no urine or one kidney/transplant, blood in urine that doesn't clear. Pregnancy with significant urinary symptoms, go to emergency care. 11. 7-day action plan, download Q day 1 to 2, start a hydration routine, fill a 1-liter bottle, finish 2 to 3 per day. Cut salt, swap processed foods for whole foods. Pain plan agreed with your clinician, get a urine strainer. Day 3 to 4, add lemon water, fresh juice, no sugar, with meals. Walk 30 to 40 minutes/day to keep urine flowing. If you caught a stone, arrange analysis. Day 5 to 6, review your diet by stone type, reduce oxalate or purines as needed. Discuss labs, metabolic eval, 24-hour urine, with your clinician. Day 7. Set long-term goals, fluids, salt and LT, 2000 mg/day unless told otherwise, moderate protein, weight/BP/sugar control. Plan follow-up. 12. Closing, though your kidneys already know how to clean. Help them do it, flow more water, load less salt and acid, and fix infections fast. Use medicines wisely, with a clinician, and skip risky detoxes. Protect your kidneys today so they can protect you for life. CTA, download the free Kidney Stone Quick Guide in the pinned comment. Comment your questions, and subscribe for more science-based health videos.